Well, we are back with Peter Van Scoyoc, the town supervisor for East Hampton. Thank you, Peter. Thanks once again for joining us here on Friday. And
Hi, Michael.
hi. And
Thanks for
I think,
having me back on the air. Appreciate that.
well, I know you're a busy guy, and but let's get right down to it. I mean, today's a big day all around with May the 15th and all that's gone on. Maybe you can fill us in. First of all, what's happening with the testing site, which today is the first day. I know um, sure you've been in touch with them and or been over there, and maybe even give us a little guideline on some of the new things that the governor put forward starting today as well. So,
Sure,
what,
absolutely. Happy to
yep,
do that. Yeah, I'm excited that East Hampton has a local testing site right here at the Panago Ball Fields parking lot, which is at 400 Panago Place. And that just kicked off. Hudson River Healthcare is doing is administering the testing, and it's been underwritten by the East Hampton Healthcare Foundation, and I facilitated those parties coming together to get this done here for our local residents. You can set up an appointment by calling the number that I think you guys are going to put up on the screen there, 845-553-8030. Set up an appointment. Tests will be given here in East Hampton on Wednesdays and Fridays. You do need to call ahead for an appointment. And then it's also being given in Southampton Village here, the hospital by Hudson River. So you can call the same number on Tuesdays and Thursdays. So now we have 4 days a week, which on the South Fork that you can get tested. If you have symptoms, if you've come in contact with a known carrier, or if you're an essential frontline worker dealing directly with the public. And there is no cost. If you don't have insurance, there may be no cost for you. And for town employees, your copay will be covered. So I'm excited that that's underway, and I want to thank Barbara Borsak, who's the deputy mayor of the village. I reached out to her because she sits on both the Southampton Hospital Board and the East Hampton Healthcare Foundation Board, and she helped pull those parties together. As people may know, we've leased the Panago Ball Fields to Stony Brook Southampton Hospital for a future emergency satellite facility here at Panago. As everyone knows, in a normal summer, that the wait times to try and get between Montauk and Southampton are really too long for some critical care. So we'll be happy when that site actually gets built too. So it seems fitting that we would have the test site there. And then we got a treat just afternoon today. The West Hampton Beach Air National Guard did a flyover in honor of all the frontline healthcare workers and everyone who's really pulled together at this time to flatten the curve, an acknowledgement of all of our efforts, staying home, sheltering in place, wearing a face mask in public and whatnot. That flyover occurred with one of their big transports flanked with rescue helicopters. Originally, they were going to make a left turn when they got to Southampton Hospital and go to the North Fork and fly up the other way. We got this test site open. They included the flyover in our test site. We're very happy that they did that and appreciate their acknowledgement of that. And it was a nice gesture.
that's wonderful. What about some of the things coming out of Albany with the governor making some changes to some of the things? What's going on?
So New York pause was extended through May 15th. Today is May 15th. He said he would make an announcement as to whether it would be extended further or not. In the meantime, he set up the 7 criteria that a region will need to meet in order to be deemed safe to reopen, with that first phase reopening. And again, first phase would be activities and businesses which had the least amount of potential risk of spreading the disease and the greatest economic input. So those would include landscaping and gardening, planting of shrubs and bushes, construction, forestry, fishing, and some other activities. Unfortunately, Long Island is not able to open up and have the New York pause lifted at this time. We still are short on, it's been teetering between 2 and 3 metrics that we don't meet the rate of new hospitalizations is one of them, and the number of deaths still occurring from COVID is another. And there's the tentative one that they think will be met very soon will be the contact tracing, which is important in understanding how the disease is moving through our communities. The contact tracing jobs are available, and if you're unemployed and looking for employment, that might be something that you could do. It does not put you in direct contact with people with COVID. It's just following up with telephone and computer. And there are a number of different positions available. You can call 311 and ask for contact tracing information, or visit the town's website at ehamptonny.gov, and there's a link for contact tracing there. You can click on, has an application and other information.
That's
So
great.
that's another important effort that we need to be moving forward with.
That's great, Peter. And there's been in the local papers and even in your board meetings, there's been some discussion about medical experts and whether we need them, whether we don't need them on some of the different committees that have been formed, and even some even working for the town. And I just wanted to give you the opportunity to respond to some of those, if you could, and give us your point of view.
Sure, absolutely. I think the one thing that none of us on the town board disagree with is that we need the very best and factual information, scientific data, and healthcare professionals' advice. And the CDC has been putting out a number of different protocols and guidelines that we've been following from day one. Actually, from before we actually had a confirmed case, my first press release on February, I think it was 27th, advising the public that this may be coming and to start practicing safety protocols that the CDC had identified. Don't touch your face, hand washing, disinfect surfaces. And we've continued to update and follow the guidelines from health professionals. World Health Organization and CDC guidelines are part of our reopening protocols. We've adopted those. The CDC also has a number of very specific guidelines for various industries, decision trees, whereby you go through, and if you meet this criteria and that criteria, then move on to the next category of things that you need to consider. If you don't meet these categories, then stop. You're not ready to open, kind of thing. So we are absolutely taking into account the very best information. I really have no problem with having a medical professional, and I know when we first created the business reopening committee, we had reached out to an individual who we've been trying to get in touch with, who's a member of the EMS. And he initially wasn't responsive. He's agreed to join as well. And again, any protocols or plans for reopening would have to be vetted and against the very best public health guidelines. We don't think that without meeting the public health concerns that we could have a vital and active economy. People have to feel comfortable and safe in order to go out and engage in any business setting. I'm really pleased to see the number of people who are taking this seriously and taking the town's advice and the advice of others when they're out in public to be wearing masks. That's going to be a new normal for the foreseeable future. Going back to the governor's metrics in reopening, some of the upstate regions have been allowed to reopen as they've met all 7 criteria. And he has stated that for Long Island, it's been extended through till May 28th. However, if in the interim we meet the metrics, then we would be able to move forward with that phase 1 of reopenings. So we had concentrated primarily on the phase 1 reopenings first, those business in particular, but understanding that others could follow as closely as 2-week intervals. the plan is that once phase 1 opens, as long as you see those metrics still being met at the end of the 2-week period, you can move on to phase 2, which would include office type work situations. We've been asking the business community, and many of the business sector national associations have been working with CDC guidelines and publishing best practices for those businesses. That'll be crucial in any reopening. And then we've gotten some additional guidance from the governor and are waiting to see the actual written clarifications and guidelines on certain activities. He's said that he wants to loosen the restrictions somewhat on outdoor activities that don't create gatherings. He mentioned tennis in particular. We're trying to get further clarification on that. I know some of the tennis clubs are anxious to resume outdoor play on the courts. We're still waiting for specific guidance on that and some other activities. Again, I think we understand that one size doesn't fit all. And so I would like to be able to have the ability as a local executive to fine tune the reopening to our locality and the specific business that might want to open, because I don't think all businesses within each of those categories are the same. And I'll give you an example. I met today with the Hamptons Art Network, which is a consortium of all the local arts organizations, Guildhall, the Watermill Center, Longhouse, Pollock Krasner, et cetera, Bay Street Theater. And some of those organizations, such as Longhouse, it's 16 acres of outdoor gardens. Clearly, you could have people take a tour, provided that they were distancing of those grounds, the sculpture gardens and whatnot, and without real fear of direct communication of disease, provided certain protocols are followed. They're in phase 4 opening, just by being arts and entertainment. Right. So again, one size doesn't fit all. I think we need to be able to fine tune. In other words, and also for instance, sports activities. Okay, maybe having a basketball game with 10 individuals on a court is we're not ready for that. But what about an outdoor yoga class where everybody's spread way out on a lawn somewhere and wearing masks? I mean, I think we need the flexibility to make those determinations locally at some point. I'm certainly glad for the governor's leadership and guidance to this point. But those are all the kind of things that we're thinking about on a daily basis.
That's great, Peter. And we're just about out of time here. And I know that by next week, I think it is, there was some kind of decision or some input that you guys are going to be giving in terms of beaches and things like that, as far as the governor goes. And so we could probably get into that more next week.
So that's my 2:30 call, Michael. I'm on the Suffolk County special beach reopening group, and we're trying to have some general guidelines and guidance put together and released to county exec to pass up to the governor on May 18th, which is this Monday. So we have another call today. We're getting close to finalizing all of those recommendations. Obviously, again, one size doesn't fit all. Local municipalities will have some flexibility to be more strict in some cases, but we're trying to have a unified approach as much as possible with the best guidance and scientific and public health data and information.
Well, I appreciate your time, Peter. I know you got to run to your other call, and we appreciate you taking the time with us today, and more to follow next week, I'm sure.
Thanks so much, Michael. Everybody be safe. Again, thanks to all our first responders and frontline healthcare workers and everybody who's doing their part to help get us through this.
You have a good weekend.
You too. Take care.
Bye.